guys. I'm Dr. Iraniha from Surgical Oasis Institute. My main practice is in Southern California, Orange County, and focus on my practice is mostly minimally invasive surgery and hernia repair. Today I decided to take you through a journey of a hernia surgery and tell you what you expect during that process, from the time that you call my office and see me for consultation until the end of recovery. So before the operation, obviously you come in and visit me during the office visits and for consultations. This consultation includes 30 to 45 minutes of conversations about your personal medical history and your signs and symptoms. And after that, I will thoroughly examine your the area that you are concerned about, and obviously we can come up with a diagnosis in some patients. So hernia is a problem that patient can come in with pain, discomfort, a bulge, and sometimes just physical examination and the initial consultations is adequate to come up with the final diagnosis of the hernia. However, there are people that coming in with different signs and symptoms like pain and discomfort without any bulge, and we are not sure 100% that they have a hernia. So then I would go ahead and order some radiologic modality, including ultrasound or CT scan or MRI, depending on the type of hernia in patients. I make that decision, and then obviously if those confirm the diagnosis of the hernia, then we have the conversations about whether you are a candidate for surgery or not. So when we come up with the diagnosis of the hernia, essentially most of the patients are a candidate for surgery. The only people that are not candidates for surgery are people who are extremely obese. Those patients, they have a high risk of hernia recurrence, means hernia can come back. And in that situations, we always recommend the patients to go on a diet or lose weight, or even if they are extremely obese, to go under bariatric surgery to lose weight for them to be in optimal situations for hernia to also increase the success of that operation. If the hernia is massive, then fixing that hernia could be problematic for the patients. There are people that they have no anterior abdominal wall, and they basically walk around with the whole intra-abdominal structures just protected with the skin and soft tissue without muscle. Those patients, they require to be in a major tertiary center, and they will need to have major operations with multiple surgeons in order to fix that type of hernia. The other group of patients that we have concerns about are people with major cardiac and pulmonary problems. Those people, they need to be cleared by a medical team prior to any surgical intervention. But if they are extremely high risk for surgery, then I would recommend them to deal with the hernia in a conservative fashion and not having the surgery unless it's sort of emergency or people present with the complications related to the hernia. At the end of the conversations and consultations that day, we're going to go over the type of technique that I'm going to use and offer them to fix that type of hernia. Obviously, my interest and my specialty and my belief is performing majority of hernias with minimally invasive surgery, including laparoscopic or robotic surgery. But there are people that they need to have open surgery. For example, if the patient had many intra-abdominal operations and now presented with a small hernia, then those patients that have major intra-abdominal adhesions and scar tissue, so performing those operations in patients with minimally invasive surgery could increase the risk of the operation. So then I recommend them to have open surgery. There are also people who are extremely old and they have multiple medical problems that need to have hernia surgery, and they cannot tolerate general anesthesia, and they may need to perform the hernia surgery with a lighter anesthesia as an open technique. Also, there are people that they have conditions that they require significant blood thinner, and those people are safer to have open surgery. Now, the other step before surgery is that we need to do the workup and what are the requirements prior to the surgery to get the patients ready. Majority of patients, I would send them for some simple blood work. People who are over 40, they require EKG, which is checking their heart, and also chest X-ray for people who are over 50 years old, or if they are a smoker. Then for majority of patients that are not young and they have other medical issues, I will send them back to their medical doctors or cardiologists, and they need to be cleared by those specialties prior to going under any surgical intervention. For people who are having diabetes and high blood pressure, we recommend them to have a very tight control of blood sugar and also their blood pressure with medical treatments prior to going under operation. Obviously, if the blood sugar is extremely high or uncontrolled, that can increase the risk of infection after the surgery. And if they have uncontrolled blood pressure, they can have a risk with general anesthesia during that operation. People who smoke, we strongly recommend them to stop smoking at least 2 weeks prior to the operation. And also people who are taking blood thinner or supplements that can thin the blood and increase the risk of bleeding during the surgery, we recommend them to stop them. So the guidelines obviously is that if you're taking any kind of natural supplements that can interfere with the surgery, we recommend them to stop it 2 weeks prior to the operation. For people who take Coumadin, we stop it 5 days prior to the surgery. Aspirin and Plavix, we stop 7 days, and there are other new medications that are on the market as blood thinner, and majority of times they need to be stopped 2 to 3 days prior to the surgery. Now let's talk about what to do the day before surgery. So first of all, we want you to have just a very light meal at night prior to the surgery, and then don't eat or drink at all after midnight. In the morning, you wake up and take a shower with the HibiClean solutions that you can get from the regular pharmacy over the counter, and then wear very comfortable outfits and come to the surgery on time. In the morning of the surgery, I want people who take blood pressure medications, take those medications with the sips of water, and for the rest of the